Do you know that out of 7.9 billion people in the world, almost 30%, which is 2.3 billion people, are suffering from tooth decay? Can we do something to prevent or even treat the tooth decay? I'm Dr. Scott Lim, your friendly neighborhood dentist. Welcome to my YouTube channel. Before we continue, please hit the subscribe button to tune in for more dental videos in the future. The answer is yes. If we know what stages are in the tooth decay and carry out necessary precautions and seek treatments earlier, we can actually stop the progress of decay and actually prevent it from happening. And today we'll explore the different stages of tooth decay and how they are being treated, and give you some tips on how to prevent the tooth decays. Generally speaking, there are 5 stages of tooth decay. Stage 1, which is the initial demineralization or the white spot lesion. This happens when the tooth is exposed to the acid produced by the plaque bacteria. The enamel, which is the outermost layer of the teeth, begins to lose its mineral. And when this occurs, you will see no hole but a white spot appear on your teeth. This area of mineral loss is the beginning of the tooth decay, and you won't feel any pain in this early stage. And stage 2, which is the enamel decay. If the process of tooth decay is allowed to continue, enamel will break down further. You may notice the white spot on your tooth darkens to a brown color. As enamel is weakened, a small hole in your teeth called cavities or dental caries can form. Here, you won't feel any pain too, because enamel does not contain any nerves. However, the cavities need to be filled by a dentist to prevent it from becoming bigger. And stage 3, which is the dentin decay. Dentin is the second layer of the tooth and tissue that lies beneath the enamel. It's softer than enamel, which makes it more sensitive to damage by the acid. Because of this, the tooth decay progresses at a faster rate when it reaches the dentin. Dentin also contains tubes, channels that leads to the nerves of the tooth. Because of this, when the dentin is affected by the tooth decay, you may begin experiencing sensitivity. You may notice this particularly when having hot or cold food or drinks, sweet food or cold air when jogging. And stage 4, which is the pulp damage. Pulp is the innermost layer of a tooth. It contains a nerve and blood vessel to help to keep the tooth healthy. The nerves in the pulp also provide sensation to the tooth. When damage to the pulp happens, it may become irritated and start to swell. Because the surrounding tissue in the tooth can't expand to accommodate this swelling, pressure may be placed on the nerve, and this may lead to pain. Usually you may feel the dull aching pain that may last over a period of time, becoming more worse, especially when you lie down, or the pain may be very severe until it wakes you up from sleep. Stage 5 is an abscess. As the tooth decay advances into the pulp, bacteria can invade and cause an infection. Increased inflammation in the tooth can lead to the pocket of pus forming at the bottom of the tooth called an abscess. Tooth abscess may cause severe pain that may radiate to the jaw. Other symptoms may be present, for example like swelling of the gums, face of jaw, fever, and swollen lymph nodes in your neck. A tooth abscess requires prompt treatment, as the infection can spread into the jawbone as well as other areas in the head and neck. And in some cases, the treatment may be involved removing the affected tooth. And the treatment that's recommended for tooth decay can depend on this stage. So for stage 1, the initial demineralization, this is actually a reversible stage where the tooth decay may be reversed before more permanent damage occurs. And this can be achieved by treating the teeth with fluoride. You can receive a fluoride treatment at a dentist's office. It's often applied to your teeth in the form of a gel or varnish. Fluoride works to strengthen enamel, making it more resistant to attack by the acids produced by the bacteria. So the fluoride can be found in some toothpaste as well as in the tap water. And for stage 2, which is the enamel decay, when the tooth decay enters this stage, cavities are often present. Fillings are used to treat cavities. When given a filling, the dentist will first use a tool to clean away the areas of the decay. Then they'll fill the tooth with some material such as resin, which is the two-color filling, or amalgam, which is the silver-color filling. And for stage 3, which is the dentin decay, because dentin is softer than enamel, the decay moves at a faster rate when it enters the dentin. If identified early, the dentin decay may be treated with a filling. In more advanced cases, placement of an onlay or crown may be needed. Onlay or crown is a covering that covers the top part of the tooth above the gums. The decay area is removed before the crown is placed, and some healthy tooth structure may be removed as well to make sure the crown or onlay fits well onto your tooth. For stage 4, which is the pulp damage, when you reach this stage, you often need a root canal treatment. In the root canal treatment, the damaged pulp is removed. The root canal is then cleaned and filled in. A crown is then placed on the affected tooth. And the final stage is the condition with abscess. If an abscess has formed in your tooth, your dentist will likely to perform a root canal treatment to remove the infection and seal the tooth. In severe cases, the affected tooth may need to be removed completely. If you practice good oral hygiene, you can actually keep your teeth healthy as long as you live. Here's some tips for you to implement to help avoid damage to your teeth by tooth decay. See your dentist at least once a year for routine examination and cleaning. Your dentist can identify and treat the tooth decay at an early stage before it gets worse. Ask about sealants. The sealants are thin coating of plastics that apply to the grooves of the tooth, especially the molars. It is recommended to floss your teeth at least once a day and brush at least twice a day with fluoridated toothpaste 30 minutes after eating, and try to avoid taking food and drinks with a high amount of sugar. Some examples are the cookies, candies and soft drinks. Instead, taking in more food such as fresh fruits and vegetables to increase the salival flow, and unsweetened coffee, tea and sugar-free gum to wash away the food particles. Drink the boiled tap water but not the distilled water, because the tap water contains fluoride, which can help to keep animals strong and protect it from decay. Avoid snacking in between meals, as this can give the bacteria in your mouth even more sugars to convert into acids. And that's all for today. Hope the information above helps you in some way. Stay tuned for the next episode on how to know if my fillings have cavities. Hope you enjoy and see you in my next episode.